Thank you, Chairman, and good morning. I have no COI. The current concept of IC-BPS is it would be reasonable to distinguish hanotype IC from non-hanotype BPS. So the aim of this study is we investigated the differences of urine markers, including VGFA, CXCL1, CXCL8, and CXCL10, previously reported as useful urine markers to detect IC-BPS patients, separated from OAB patients. Urine was collected from 22 IC patients, 25 BPS patients, age and gender matched 23 OAB patients, and 12 controls. In other group of patients, bladder biopsy tissues were collected from 14 IC female patients, 12 BPS female patients, and 14 age-matched female patients. According to the ROC analysis, VGFA, CXCL10, CXCL1, and CXCL8 were significantly useful to detect IC-BPS patients in all participants. On the other hand, CXCL10, CXCL8, and CXCL1 were significantly useful to detect IC patients, whereas VGFA was significantly useful to detect BPS patients. The expression of VGFA in bladder tissues was significantly increased in IC-BPS patients compared with controls, whereas the significant increases in the number of T lymphocytes, increases CD3, were observed in IC patients compared with controls or BPS patients. The significant increases in urine CXCL10 levels and the number of T lymphocytes in bladder tissues were observed in IC patients, and CXCL10 was a useful urine marker to detect IC, indicating that Hanna region is associated with the true interstitial inflammation modulated by activating T lymphocytes. The possible mechanism of the increases in urine VGFA levels could be hypoxia in bladder tissues due to chronic inflammation in IC patients, whereas the mechanism for the increases in VGFA levels in BPS patients remains unknown. In conclusions, it would be useful to detect IC and BPS using CXCL10 and VGFA as urine markers respectively, suggesting that IC and BPS could be classified as a separate entity of the disorder in the future. Thank you. Thank you very much.
Thank you. Are there any questions from the audience? I have one question. Have you separated this according to age? Did you see any differences?
Age?
Age.
I didn't, but usually IC patient is a little bit older compared with BPS patients, but I didn't check.
Okay, thank you. If there are no questions, then we'll move on to the next paper. Thank you very much.
Thanks so much.